And hello, my name is Adriana Estrella and I'm going to talk about randomized trial of Posaconazole and Benznidazole for chronic Chagas disease. In definition, Chagas disease is a chronic parasitic infection caused by the protozoan Trypanosoma cruzi, is considered to be one of the neglected tropical diseases. Although Chagas disease was identified more than 100 years ago, current therapeutic options for this condition are limited mainly to benznidazole and infotimox, and the phase of the disease is one of the factors that determine the success of treatment. And applications in medicine, cure rates of 65 to 80% have been documented when treatment is administered in the acute phase of the disease, with rates reaching almost 100% in cases of congenital acquired infection that is treated during the first years of life, whereas the therapeutic response is as high as 60% among children at an early chronic stage of the disease. Cure rates among adults when the disease is in the chronic phase range from 15 to 35%. In addition to the low efficacy of current drugs in patients with chronic disease, another major drawback to this drug is their toxicity profile, which led to definitive withdrawal of treatment in 15 to 30% of patients.
Chagas disease is caused by a highly mobile, microscopic parasite called Trypanosoma cruzi, or trypanosome. The parasite is transmitted by a vector called the triatamine bug, nicknamed vinchuca in Latin America. The bug hides between stones in the walls of houses and under straw roofs. During the night, the vinchuca comes out of hiding to feed on human blood. When it's finished feeding, it defecates next to the bite. The victim later scratches the bite, unwittingly helping the parasite to enter the body. The parasite that causes Chagas disease transforms throughout its life cycle. The parasite penetrates the tissue cells and multiplies before entering the bloodstream. Once in the bloodstream, it infects even more cells. This is the first, acute phase, which lasts about 2 months. Due to the large number of parasites in the blood during this phase, it is the only time the disease can be diagnosed. People may not even know that they are ill as symptoms are so mild. A slight fever, headache, pallor, and muscular discomfort. Chagas disease does have some very recognizable signs, but they're rare. A skin lesion around the bite, or swelling of the eyelid, called Romagn's sign. Then, nothing at all. This is the chronic, asymptomatic phase, and for years or even decades, infected people have no apparent symptoms. The disease deserves its nickname, silent killer. 10 to 30 years later, a third of sufferers develop the chronic phase. It can be rapid, and some people die without ever knowing they had the disease. During all these years, the parasites have been present in several of the body's organs. In the digestive system, they cause the colon and esophagus to dilate. In the nervous system, they can cause dementia. In the heart, it can lead to cardiac disorders, some of them fatal.
In pros and cons, Cons. Crossing the model of chronic Chagas disease, the differences weren't even greater. Posaconazole was associated with cure rates of up to 60% in animals infected with susceptible and partially susceptible T. cruzi strains, whereas none of the animals treated with benznidazole were cured. And in cons, the currently available options for treating T. cruzi infections, benznidazole and nifurtimox, have shown limited efficacy in the treatment of late stage of the disease and have an unfavorable side effect profile.
Chagas disease, also known as American trypanosomiasis, is a disease caused by a group of parasites called Trypanosoma cruzi. Chagas disease is named after Carlos Chagas, a Brazilian doctor who first described it in 1909. African trypanosomiasis is a different disease caused by Trypanosoma brucei. It's estimated that about 6 to 7 million people around the world, mostly in Latin America, are infected with this parasite. About 10,000 people die each year because of this disease. Let's have a look at how this disease is transmitted. People can get infected in different ways. The most common way is through several species of blood-sucking insects called triatomine bugs. These insects get infected after biting an infected animal or person. The bugs tend to live in crevices of walls and roofs of houses, most commonly in houses that are made of materials such as mud, straw, and palm thatch. They come out at night to feed on people's blood when they're sleeping. Because they tend to bite people's faces, they're sometimes called kissing bugs. Now, once they bite, these bugs can defecate on the person's skin. Their feces contain the parasites, which can then get into the person's body through the bite site, through mucous membranes, or if there's breaks in the skin. The infection can also be transmitted through food that has been contaminated with feces of the infected bugs, through lab accidents, blood transfusions, organ transplants, or congenitally, from mother to baby. Let's have a look at how the disease presents. There are two main stages of the disease, an acute phase and a chronic phase. In the acute phase, symptoms generally start to develop after about 1 to 2 weeks following the bite. These are generally mild and non-specific. Symptoms include fever, malaise, headache, rash, diarrhea, and vomiting. There could be enlargement of the liver, spleen, or lymph nodes. Sometimes there can be a skin nodule called a chagoma, or a swelling around the eyelid called the romanicine at the site of the insect bite. The symptoms generally last for a few weeks or months. Some people may not have any symptoms. Very rarely, the disease could be severe in the acute phase. This is more common in children or those who are immunosuppressed. The disease then moves on to the chronic phase. In this phase, about 70 to 80% of people may not show any symptoms at all. However, in about 20 to 30% of people, the disease can progress, mainly affecting the heart or the intestine. This can happen 10 to 20 years after the initial infection. In the heart, the disease can cause enlargement of the heart muscle, leading to heart failure or disturbances in the heart rhythm. In the intestine, there can be enlargement of the colon or the esophagus. This can lead to difficulties in swallowing food or passing a bowel motion. It can also affect other parts of the body, such as the ureters. The coexistence of other diseases, such as HIV, can result in the disease manifesting differently. It's also harder to diagnose and treat. Chagas disease is diagnosed by laboratory techniques. The most common method is by detecting the parasite in the blood using microscopy and is useful for the acute phase of the disease. Because there are very few parasites in the blood in the chronic stage, other techniques such as checking for antibodies in the blood or detecting the parasites in tissue biopsies is more useful. Other methods include culture and PCR that detects the genetic fingerprint of the parasite. So, how do we treat the disease? Treatment focuses on two aspects: eliminating the parasite and managing any complications. Antiparasitic medicine can be used to kill the parasite and is most effective in the acute phase. Treating the complications of the disease will depend on the organ affected and how bad the damage to the organ is. They include pacemakers or medication for heart rhythm abnormalities, medication, changes in diet, or surgery for intestinal complications. So how do we prevent and control the disease? There is no vaccine or preventative drugs that can be taken to stop people from getting the disease. Controlling and minimizing contact with triatomine bugs that carry the parasite is one of the most effective ways to control the spread of the disease. This can be done through activities such as spraying houses and surrounding areas with insecticides, improving housing standards and cleanliness to reduce the number of insects living inside, using bed nets. Other measures include reducing the burden of the disease by good surveillance, diagnosis, and treatment, reducing contamination of food through activities such as properly preparing and cooking food and keeping food covered, screening blood supplies and organs to make sure that they don't carry the parasite, screening newborns and other children of mothers who are infected to ensure that the disease is diagnosed early and treated. And that's a quick look at Chagas disease. For more information, have a look at the websites below.
An issue applied in the Ecuador, given the toxicity and poor therapeutic effectiveness of current treatment options for chronic Chagas disease, the clinical and microbiologic efficacy to Posaconazole as a triple agent in animal models, and the safety and side effect profile of Posaconazole in persons who receive this drug for the treatment of foodborne infections. In conclusion, in patients with chronic Chagas disease, treatment with low-dose or high-dose Posaconazole results in a significantly larger percentage of treatment failures than the treatment with Benznidazole, which is the current standard of care. And thank you.